What this sector means to World Vision programs is that it ensures that all our programming areas, all our investments, developments are like protected from hazards which may eventually turn into disasters, such that the people that we are putting them in place for do not lose their source of livelihoods, would not lose their lives. We ensure that lives are saved and investments are protected generally. Our ERDM strategy tries to combine relief preparedness, response, and development. So we are into a process of, moving on along that path to eventually move away from only response. However, we find that because we do not work in isolation and we work in several areas, most of our projects, most of our areas that we work in are faced with hazards, disasters most of the time. Like this year alone, we are responding to about 4, the emergency response from the DRC refugee influx in Kamwenge district, where we've had a population of about 30,000 refugees coming to the district, and our host communities are stressed, and among the refugees are children, several children. So we have programs out there trying, to restore the hope of these refugees. We're also responding to the nodding disease in Kitgum and Gulu districts, where all the people who have been affected are children. A number of them have lost their lives, a number of them do not go to school, a number of them have been abused at home. So we have programs that are trying to better the lives of these children. The Ebola outbreak in Kibale, this was a unique one in that we really could not be there actually helping, but we networked with a lot of health organizations, providing information, all geared to saving lives and, making sure that the livelihoods of the people that we support, the beneficiaries, are not eroded. Summarizing the impact of the ERDM sector in one sentence would not be easy. Most of our sectors really contribute to livelihoods. So if hazards affect the activities of these sectors, then these programs are not achieving their objectives. We really contribute a lot to these sectors achieving their objectives.
Health and UWASH are dedicated to addressing the common causes of child and maternal mortality in the rural communities, especially amongst the poorest households, who are the majority contributors to the national statistics. We work with the government and other existing partners through established government structures at household level, at community level, and also at national level. At national level, we work through policy influence, and at the moment we're using the Child Health Now campaign to address issues to do with maternal and child health. We work at household and community level, mostly using existing community health workers who are called the village health teams. We teach them practices, especially nutrition practices. We also address common conditions like diarrhea diseases through proper sanitation and hygiene, and also malaria through distribution of nets and education on net usage. And we also look at issues to do with HIV/AIDS, where we increase access to HIV/AIDS services, especially for mothers and children. In the past 1 year, we've supported the government to implement Child Days Plus, where children are dewormed, vaccinated, and also mothers are taught on proper health and nutrition practices. Through our ADPs, we've also distributed about 72,000 insecticide-treated nets, about 45,000 to children, and the rest to pregnant women through antenatal care clinics. We've also helped with ARVs and linked about 18,000 women and 450 children to receiving antiretrovirals. We're expanding health and WASH to the Karamoja region, which is the major contributor of poor health statistics for the country. So we are using a nutrition approach that has been founded by USAID, that is through the DFAP.
Education to World Vision Uganda means an opportunity for World Vision Uganda to work with the children, girls and boys, their families, the communities and the local governments in their areas of jurisdiction to enable children unlock their full potential. And when we talk about unlocking their full potentials, there are 4 things that we like to see us achieve together with the children and their families. One of them is that at the end of their education, the children should be able to read, write, and use their numeracy skills. Secondly, we want to see children being able to make good judgment. They can be able to protect themselves, and they can be able to communicate ideas, but as well manage their emotions. We wouldn't like a situation where a child enrolls today, and the next hour, the child has dropped off, or the next week, the child has dropped off. Then, at the end of it all, the 4th aspect is that, the children, girls and boys, are ready at the end of their education life to take up economic opportunities which will help them, live a decent livelihood. That's what education means to us as World Vision Uganda. Government is mandated to provide education service, so we complement the efforts of government. The last but not the least is advocacy. You realize that World Vision cannot achieve this alone. So we need the voices of children, girls and boys to be heard on those issues that are depriving them the right to achieve education. Things like, not having meals in school, things like a harsh environment could be at home, in the community, or at government or policy level that tend to hinder their education. Our dream for the next 3 years is looking at improved equitable access and quality education for girls and boys. We would like to consistently ensure that there is equity for both girls and boys, but also quality in terms of the learning outcomes of boys and girls. That is our commitment in the next 3 years.
We do exist as business partners with management to be able to attract, retain, develop, and be able to have fully engaged employees. And we do this by ensuring that all our HR processes create value for money, and we also make sure that we strengthen performance, we strengthen staff engagement, and we also partner with managers, we partner with other divisions to promote a culture of accountability and making sure that we have a depth of talent. And we've been able to make sure that once we have this talent, then they are fully oriented so that then they can be able to integrate so easily and be able to deliver on their objectives. In my background, you can see a fitness program because we believe that actually a health employees make up a health organization. We've been able to enter into a memorandum of understanding with a counseling service provider who are available, and employees can talk to them at any one time they want. Our staff turnover rate has been very low. We have been able to bring this down to below 6%. For next year, we are trying to make sure that we align better P&C processes with the organizational strategy. And so the structure, the systems are all going to be revised so that then they can facilitate the achievement of our national office objectives and be able to contribute to the achievement of child well-being outcomes.
During this fiscal year, we have completed implementation of our 3-year strategy, which we began in 2010. And over this period of 3 years, we have implemented integrated programs that have combined water and sanitation, health projects, education projects, and agricultural projects in order to enhance the well-being of more than 1 million Ugandan children. And during this period, we have achieved a number of significant results that we can celebrate. However, in the same period, we have faced 2 significant programming challenges. Our programming has focused on supporting children and families in the rural areas. But as we have done this, we have observed the number of children living in poverty in urban areas increasing over time. In the next 3 years, we will be broadening our focus to target children in urban areas who live in poverty, to help them and their families to be able to improve their well-being and bring the same type of assistance to them like we have been extending to children who live in rural areas. The second challenge that we faced was the impact of climate change. During the last 3 years, the impact of climate change on agricultural production and productivity in Uganda has become more visible and intense. And in our new strategy, therefore, we will be promoting agricultural interventions that strengthen the capacity of poor families and communities in rural areas to be able to mitigate the impact of climate change on their livelihoods. What I can promise our board of directors and partners is that over the next 3 years, they will see us as World Vision Uganda raise the bar in terms of the impact and sustainability of our work. We have set for ourselves very ambitious targets, and we have strengthened our internal performance management systems in order to be able to hold ourselves accountable to contribute significantly towards improving the well-being of children in Uganda over the next 3 years.